Sorry for the inconveniences. So I was able to tell you that the discovery of the drugs used in psychiatry gave birth to the scientific history of psychiatry. And I say because of the discovery of those chemical substances in the brain and how we try to produce some synthetic or exogenous substances in order to mimic those neurochemical substances in the brain. So we now realize that the first one that was discovered in 1950 were the CPZ or chlorpromazine or thyroidazine. So we now discover that this thyroidazine or chlorpromazine that have been discovered have its efficacy in the blockage of dopamine in the dopaminergic pathways in the limbic system. And they remember that the dopaminergic pathway is basically found in the neuroscience pathway, which is found in the ventral tegmental area of the brain. So, and these areas are basically motor oriented, and being motor oriented means they can as well control the motor movement, they can control the motor aspect of the muscles, where we have the skeletal muscles, and also they also coordinate this movement and as well initiate the movement. And because of this motor coordination and modulation function of dopamine, this substance also used to block this dopamine that was implicated in this behavioral excesses leading to psychosis or psychotic manifestation. So, and we now notice that since 1950s, we now realize that these particular substances have a very strong efficacy in the stopping of this psychotic problem. And now, because of the function of dopamine in motor movement, that is the motor function of dopamine, sorry, we now realize that in the process of blocking dopamine excesses, we might also block the movement functions of dopamine and makes the mental function of dopamine. So we now discover that this dopamine that is being blocked with this use of antipsychotic can also help the individual in movement, can also help the individual in understanding, memory, attention, and what to call psychological stability of the individual behavior. So for those higher functional aspect, the higher mental function of dopamine, if using psychiatric medication for long time, you see that there will be some impairment of these particular functions. So that is why sometimes I advise people that the treatment of mental illness is best used for psychological than use of drugs because of the after effect of drugs. Though some persons may seem that I'm trying to mislead the individuals, and but I'm trying to say the facts, because so when the fact is being explained or when the masses know the truth, they will understand the best option. Though I'm not criticizing psychiatry, neither am I here to cause a psychological blunder or psychiatric blunder, but based on the extensive research, I was able to deduce this. Please, this is not for treatment's sake. This might this is for educational purpose, and I'm using it to pass knowledge to people, and on no account you should use this video to treat patients, because I will never mention doses of drugs, rather I will only classify the drugs. That's why to prevent what we call packing in every area of your practice using the video, I will best classify the use of drugs in psychiatry into different ways. So I will use classification model in classifying drugs used in psychiatry. I have one of the basic classification model is called the old classification, And the old classification, I mentioned things like the psychoactivators. Psychoactivators, they are those drugs that activate the psychomotor activity of an individual. Example of these psychoactivators are basically those drugs that are used today as antidepressants. So they activate the individual retarded brain or inhibited brain or inhibited psychomotor activities. Where the number two is psychoinhibitor, is the opposite of psychoactivator. This one they inhibit the brain and reduces the psychomotor activities. So this one increases the psychoactivator, increases the psychomotor activity, where psychoinhibitor decreases psychomotor activities. Then we have the psychomimetics. The psychomimetics, they are basically drugs that mimic an individual psychotic-like phase, or they are those substances that places an individual into a psychotic-like phase. They make you to behave like psychotic individual. Remember that psychoinhibitors, example of them is that of antipsychotics like CPZ and others. But the psychoactivators are those drugs that they can stimulate you, can place you in a psychedelic phase, or they can make you become confused or become hallucinating or become hallucinated. So when you're hallucinating, call it hallucinogens. Example of psychomimetics, we have confusants like lysergic acid ethylamines. They are basically example of psychomimetics because they place that individual in a confused state. For example, excessive use of alcohol can still put you in this stage because the increase or overdoses of alcohol can put you in a psychotic phase, being in a confused manner. We still have some psychedelic aspect of it, like marijuana can make you to become schizophrenic in nature, where you can be hearing voices and you'll be more intelligent at that point. But the intelligence is highness oriented intelligence, which after a while the highness will disappear. So I prefer you should either use your book and get high than to use drugs and get high. Then we still have stimulants under the psychomimetics or psychotomimetics, depends on textbook or resources. We have stimulants like methamphetamines. These drugs, they causes dopamine, helps to keep an individual in an attention phase. Those that are having attention deficit hyperactivity disorder take things like amphetamines or basically amphetamines like Dexedrine, Adderall, and Ritalin for them to maintain that individual patient to be very, very attentive. What about when the individual, overpass that stage of having that attention deficit disorder? And long-term use of these drugs might also have a side effect. So the side effect becomes the opposite of its action. So that's why we always advise that you better utilize the psychological method than the use of drugs. So it's basically, this video might look like a critics, but I'm trying to tell you the fact based on my long time practice in the clinical area, which is the fact and the truth. So then after this, I still want to tell you that the classification model have another classification approach. We have say the chemical classification method, where for instance we have the phenothiazines. The phenothiazines or phenothiazines depends on how you want to pronounce it. Is it biology or chemistry, but spell it well. Are basically those drugs that use the thiazines or as each component structure of phenol and thiazines as each component structure, where if most of the drugs that come from this are very, very active to an extent, but does not have a very high potency like that of butyrophenol aspect of it. So these drugs, example of these drugs are basically CPZ, like chlorpromazine. You can still see drugs like stelazine in this particular classification. So because I don't want for abuse of this video, that's why I will not mention this, because some person want to know the drug so that they can be treating their people in privately or partly or locally in their villages or in their home without consulting a psychiatrist. So we still have the butorphanol. Butorphanol are basically classified under Hador. So any butorphanol, example of butorphanol is Hador. This Hador is haloperidol hydrochloride. Then we have the thiazentines. Thiazentines are examples of thiazentines are basically that of fluphenazine decanate and flupentazole decanate, which some people call it Modicate and Depizole. So these drugs are under the thiazentines. So we still have the atypical classification. That one is called piperidine, where we have the piperidine classification chemical or piperidine phenyl hydrochloride. Most of these drug classification are the attain-oriented drugs. So these drugs are basically work within the cholinergic pathway. So the piperidine classification are also known as an atypical classification of the chemical um, group or chemical classification of substances. Then we have classification based on function, which is a very large classification, and I'm going to take a fresh note for that for better comprehension. Thank you.